course, people often need to make a big up level in their diet, but I try and give them really actionable steps. So what food, kidney cancer, how can we get off those things that are immediately going to put intense pressure on that system, and what's going to happen in the future and all the things that can bring up. Just figuring out how to get some good sleep. I love Mel.
Hi everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Cargenesis supplement range to support people diagnosed with chronic kidney disease. And I'm excited today to be joined by one of my fellow Australian colleagues. So you're going to have to put up with a double Australian accent today. The beautiful Carla Wrenn. Carla is a naturopath. She's been a naturopath for over 22 years, but Carla has got a passion for treating oncology and long haul COVID. She's had a very successful clinic down in the beautiful Mornington Peninsula area of Melbourne. For those in the US who don't know where it is, it's definitely a holiday destination spot. And she's been caring for very complex cases for a very long time. I actually have known about Carla for a long time because she's very well renowned in our naturopathic inner circle, I guess. So she's always the one that everyone goes to ask questions about cancer. But what are some of the things, if anyone's listening now, that they could potentially integrate into their day-to-day?
Yeah, so I would look at the 6 modifiable lifestyle factors that really come out of my interest in functional medicine. And so it would be their food, like how can we simply clean up their diet? And a lot of patients will come with a bit of orthorexia too. So that's the fear of food. And now they suddenly think they can't eat anything. And of course, people often need to make a big up level in their diet, but I try and give them really actionable steps. So what foods should we focus on? And how can we increase the nutrients from our food and the quality of our food? So we work with simple things rather than trying to take too much out, and more try to enjoy these foods the most. And then the same would apply with alcohol and coffee and soft drinks, like how, especially in bladder cancer and kidney cancer, how can we get off those things that are immediately going to put intense pressure on that system? The next thing I think about is sleep. And so just getting sleep, and even if it means I have to give them something to help them get better sleep, is known to have a huge impact on cancer, but also on their ability to cope. You know, if they're in fight or flight and now they're not sleeping, or they're waking in the night worried about their diagnosis and what's going to happen in the future and all the things that can bring up, just figuring out how to get some good sleep. I love melatonin, and also, of course, the herbs and nutrients, magnesium, and lots of our passion flower and beautiful herbs. So just getting them to sleep is the next thing. We talk about movement and exercise, but a bit like the stereotypical patient will have done one of two things. They will have stopped exercising because they feel like they need to wrap themselves in bubble wrap, or they will have joined CrossFit and started like manically exercising, which is also not helpful. So we try and talk about exercise they enjoy, and encouraging them on doing things. Or if they don't have an exercise they need to enjoy, or they've had surgery and they need to change exercise, to maybe hook them into an exercise physiologist or some kind of health professional that has experience in the stages of cancer and exercise. Because the research says moving during cancer makes pretty much one of the biggest differences a person can make, and it doesn't have to be intense exercise. And then I also talk to them about things like spiritual connection and social connection, who is their support system, and then also, rest and relaxation. How can they restore themselves? Are they taking enough time to do that? And I guess then the other side is purpose or legacy, especially if someone's very unwell. If someone is unwell, I try to get them to anchor into the things that are important to them about achieving in their life. Have they achieved those things? Do they have purpose? Because I feel in cancer, when the battle is hard and a person is overwhelmed, it's easy to slide off into a bad place if they don't have a connection to a purpose or something that they're trying to achieve.
Carla, thank you so much. I really appreciate you as a person and your time. If you want to know more about what we do, head to www.kidneycoach.com. You'll also find us on Facebook and Instagram and all of those social media platforms. Remember to hit subscribe and like. That way you will be notified anytime we put out more information. And if you have any specific questions for Carla, please put them in the comments below, and I'll be sure to reach out to her and ask, or you can find a contact page on the websites that I've put in there. Thank you for being part of our community, Carla. Thank you again for everything. I'm sure we'll have you back to talk about other things. And enjoy your day. And thanks to everybody for listening. Bye.
Thank you.